It was no surprise that the Prime Minister should be visiting a hospital this morning. The only real surprise was for an unsuspecting nurse on her first day.
Prime Minister's secretary is saying this happens every day,
Of course, Theresa May was here to set out the government's 10-year vision for the NHS in England. It's 100 pages of ambitious commitments aimed at securing its future for the next generation.
The NHS is the public's priority, and so I've made it my number one spending priority.
1/3 of the extra £20 billion will be spent on GPs, community care and mental health. Central to the strategy is integrating the NHS and community care. Local health teams will have to provide fast support for patients in their own home to avoid hospital visits. Those at risk will be offered healthy living programmes. Digital technology will be overhauled, increasing online GP bookings and offering outpatient appointments over the phone. And killer diseases will be tackled, including improving early diagnosis of cancer.
How can you possibly deliver on that when local authority budgets have been slashed so much? Will you guarantee that local authorities will get more money for social care and for public health services?
Well, of course, we're already putting more money in for social care to local authorities. You indicated you thought that it was just focus on certain areas. Yes, it is about prevention. It's also about better early diagnosis, better detection, treatment and recovery.
Are you experiencing any shortness of breath at the moment?
This is the Prime Minister's vision in action. In Tameside, the NHS works with local authorities so care home patients can Skype medics to avoid having to travel to a GP or to a hospital. It's joined up care that's working.
See you soon. Bye.
But those who represent the NHS Trust say the plans are too ambitious, given the state of the service today.
We need to fill the 100,000 vacancies that we've got on the front line. We need to have more staff. We need to sort out the social care system. The government's been promising to do that for a long period of time, governments of different colours, and they've still not done that. So that's really important. And then a key part of this plan is we want people to take more responsibility for their own health and well-being. That means we're going to have to invest more in prevention.
We're clearly going to need more nurses, more doctors, more therapists, and the majority of the extra funding that's being made available will be used for those staff.
But it takes time to train staff, doesn't it?
It does, and so some of the training expansions that are already in the pipeline will bear fruit over the course of this next 10 years.
It will certainly need to if this plan is to deliver on all its ambitions.